A very warm welcome to everyone joining the Fragile X Syndrome and Medications webinar with Dr. Jonathan Cohen. I know in Australia it's customary to begin with an acknowledgement to country. I'd like to acknowledge in Aotearoa, New Zealand, we recognise Māori as tangata whenua, the first people, and the Treaty of Waitangi as our founding partnership document between Māori and European settlers. So my name is Andrea Lee and I'm the Executive Director for Fragile X New Zealand, and I'm also the mother of a 20-year-old son with Fragile X syndrome. So I'd like to hand over to Wendy for acknowledgement to country and housekeeping.
Thank you, Andrea. Hello, everyone. Welcome to our first webinar for 2025. Very exciting to be back on the road with these. So I'd like to acknowledge the traditional custodians of the lands on which we're all meeting tonight. Liz and I are here on Gadigal land, and I pay respects to leaders past and present. And I extend respect to everyone of First Nations heritage who is joining us tonight. So I do have a few announcements or ads, just a few things to let people know about. First of all, Fragile X Association of Australia, we're thrilled that we have booths at some great disability expos coming up this year. So we'll be in different parts of the country at those. The first one is in Geelong, as you see, 14th and 15th of March. So if you're in the Geelong area, hop along and say hello to Cynthia. Cynthia's the president of Fragile X Association, so she'll be there on the table together with one of our family members, Mary Wilson. The next one is in April in Penrith. So Liz will be attending that one, as will I, and the one after that is in Newcastle. So these are a great opportunity for people to get a bit of a preview of goods and services, products and information related to disability. And we love to be there because it's a great way to raise awareness of Fragile X as well and meet service providers. I also want to give a shout out to our webinar program. So as I said, this is the first for the year, and we've got some great webinars coming up over the coming months. Next one is Sensory Diets and Fragile X Syndrome with Bev Kadish. So Bev is an OT with a great deal of experience in supporting children and adults who have Fragile X syndrome, and she'll be talking about sensory processing in Fragile X. Some of you may have met Bev in person at her clinic or at Jonathan's clinic, or indeed in our webinar series. And then we have a couple of webinars that are of great interest for people who have the Fragile X pre-mutation, and some future planning webinars coming up as well. Also want to just let people know that this particular clinical trial in Fragile X syndrome is still going on. Enrollment in the study is open in early 2025. Recruitment is taking place in a range of countries in the US, Europe, New Zealand, and Australia. So this particular product is a synthetic CBD gel, and the goal of the trial is to evaluate this particular gel and its efficacy in addressing behavioural issues related to Fragile X syndrome, such as anxiety. So the trial is currently enrolling ages 3 to 29, but the age ranges, as you see on the screen, vary in different sites. Brisbane at the Children's Hospital with Dr. Honey Häusler. Melbourne is Dr. Cohen's Fragile X Alliance Clinic. And Sydney, it's Westmead Hospital. And in New Zealand, Andrea, it's Dr. Andrew Marshall, is that right, the paediatrician?
That's correct, yeah.
Yeah, so if anyone has an interest in looking at the potential to have your child enrolled in that trial, the contact details are on the website there that I've got on the screen, fragilexhelp.com.au. So it's open for a little while longer at the beginning of 2025, with top-line results, I believe, due about third quarter this year. So that trial's been running for some time.
Thanks, Wendy. And as many of you will be very well aware, Fragile X has been widely researched, and as a result, unlike many rare conditions, we have excellent evidence-based information and best practice supports, interventions and support and treatments. We know that medication sits along environmental and learning accommodations, specialist interventions like OT and speech language therapy, and understanding the support needs of our family members affected by Fragile X. Dr. Jonathan Cohen brings his clinical expertise and knowledge about medications and Fragile X to this multi-layered approach to achieving good outcomes. Dr. Cohen is the medical director of the Fragile X Alliance Clinic and Genetic Clinics Australia in Melbourne. He holds a Master's in Family Medicine and is currently Adjunct Senior Research Fellow with the Centre for Developmental Disability Health Victoria, Monash University Department of General Practice, and Honorary Research Fellow with the Murdoch Children's Research Institute. He's a member of the Fragile X Association of Australia Scientific, Clinical and Research Committee. Dr. Cohen is involved with numerous research projects, author of multiple articles for medical allied health journals and lay press, and presents internationally on Fragile X syndrome. I know Jonathan is known to many of you here. For those of you who are new to Fragile X, I can share that personally Jonathan is one of my favourite people in the Fragile X world, and I've had the pleasure to hear him speak in many different settings over many years now. So as a parent, I appreciate his deep knowledge and understanding of Fragile X, both as a doctor and academic researcher, and his ability to incorporate his lived experience as the father of adults with Fragile X. It's also incredibly invaluable to us to have an Australasian approach to medication in Fragile X.
Thanks very much, Andrea, and thank you on behalf of the Fragile X Association of Australia and of New Zealand, who are doing this together, for asking me to present today on medications in Fragile X syndrome. So just for some introduction, as I'm sure everybody knows, Fragile X syndrome is the most common known inherited cause of developmental delay and autism disorders. It's a neurodevelopmental condition. So it's not behavioural, but it's due to the biology of the brain and the neurobiological system in people, which results in emotional problems, including anxiety, hyperarousal, ADHD, aggression, epilepsy, and autism. Although this presentation is on medications, it's important to emphasise that behavioural management strategies and modifications to the environment can be of great help to improve people's lives. So it's a combination of both behaviour management and environmental modifications, as well as medications, that can make all of the difference. We treat a lot of conditions that we see in Fragile X. They're listed on the left side of the screen. Everybody will be very familiar with anxiety and ADHD, and we sometimes see people become aggressive in different situations and sometimes harm themselves. We see mood disorders, obsessive compulsive disorders, seizures in about 10 to 13%, bedwetting, and difficulty sleeping. And there's a wide range of medications that we use for each of these conditions, and I've listed those on the right-hand side. And we'll go through some of these now. So first thing to understand is about anxiety is that it's an emotion. You can't see a person's emotion unless it comes out with physiological features or with their behaviour. Anxiety is an emotion, it's what we feel. You can't see a person's emotion, but it can lead to hyperarousal. So especially in Fragile X syndrome, if a person gets worked up, become hyperaroused because they're anxious, then the adrenaline, noradrenaline system will kick in, and they'll get what's called a fight or flight response. So they get ready to fight or they run away. And that's a very basic brainstem response common to all animals, including humans. If that hyperarousal is so pronounced that you see it, it will appear as the blood vessels in the face will become red. People will flush. They might start to shake, cry, might start to get very agitated, walking or running. They can become aggressive. They might start to swear or yell or shout. And it's that agitation that we see that we interpret as anxiety. So what's a definition of anxiety? Anxiety is where there's excessive worry for at least 6 months. So it's normal to be anxious for sometimes. You might be watching your favourite football team lose and you're getting anxious, but if it's there, if you're worrying about it for a long time, it becomes pathological. It becomes a disorder. So much so that it might significantly affect people's social or work function. And another feature is the person finds it difficult to control that worry. So the Diagnostic Statistical Manual of Psychiatric Disorders, the DSM-5, they're now up to number 5, defines it as having any 3 or more of these following conditions. So a feeling of restlessness, being on edge, tiredness, difficulty concentrating, being irritable, muscle tension, or sleep disturbance. And many of you are probably sitting there thinking, well, I've got all of that. And you may, but if you've got more than 3 or more, and that's been going on for 6 months, then yep, you have an anxiety disorder. And that's pretty common. Lifetime incidence with symptoms of anxiety, current symptoms of anxiety in Australians, it's about 10%. It's about 1 in 10 people have ongoing anxiety. It's common. So the DSM-5 categorises anxiety disorders into these different conditions. So generalised, it's anxious all of the time. Panic disorder, so you might be fine for most of the time, but every now and then you just completely lose it. And again, it's been going on for a long time, and it interferes with your home or work life or your normal function. Social anxiety disorder or social phobia, at the lower end is shyness, extreme shyness, but sometimes that can move across to selective mutism, where people just don't talk. And that's not an uncommon condition, especially in some of the girls with Fragile X syndrome. There's, of course, post-traumatic stress disorder, which is not so common in Fragile X syndrome. And obsessive compulsive disorder, so obsessions are where you're worrying about something all of the time. Compulsions are when you're actually doing something, like, for example, washing your hands or picking at your skin or fiddling with things. So that's actually been in DSM-5 moved out of the anxiety spectrum, but it's really a similar type of condition, and it's amenable to the same medications. So here we've got a graphic of a nerve. That's the cell body, the soma, that's the axon. They're the actual nerves that transmit impulses, electric impulses down the nerve. And at the end of the nerve, these little parcels of chemicals, neurotransmitters, are released across to the next nerve. That's how nerves talk to each other. So electric impulse comes along, releases these little neurotransmitters into the next cell. And these neurotransmitters can be things like noradrenaline, adrenaline, serotonin, dopamine. And there are various medications that can either block them or keep them there for a lot longer so that they help transmit functions and help the nerves pass on messages. And this is an electron microscopy of a real nerve cell, and you can see these little bubbles there. And that's what's called the synaptic cleft. That's where the chemicals go, and then they move on to the next nerve. So sertraline is a systemic serotonin reuptake inhibitor. So it keeps serotonin in the synaptic cleft between the nerves so that it keeps working and keeps on transmitting impulses. The brand names that you'll be familiar with are things like Zoloft, Eleva, Sertra. And this is widely used as a first step in people with anxiety and also depression, although we don't see a lot of depression with the Fragile X full mutation. So it's used for all of those conditions that you've just seen up: anxiety, panic disorder, OCD, also for mood and irritability and for aggression. And by reducing the anxiety, people worry less, they don't get so hyper-aroused, and they don't exhibit the symptoms that we see physiologically. It's easy to take. It's once a day. We often use very low doses in Fragile X. Often don't need the usual doses that some people are on. And it's generally quite safe. There's a few side effects. The side effects are where you get a paradoxical increase in anxiety, which is short-lived, and people usually get used to the medication, or we stop and go to a different SSRI. It's most commonly used together with a stimulant medication for ADHD. So I mentioned before that it's not just about medications. This is a picture of a young boy's handwriting. You can see it's pretty messy up there. And this is when his OT gave him lines, which the pen could actually feel these raised lines. So he was able to draw a lot neater just by having these lines to keep his pen within. So this is a behavioural strategy, and you can see the improvement in writing. What's striking, however, is that when he was put on sertraline, this is the same boy 2 weeks later, and he's aged about 10 at this point in time, and his writing is very smooth. It flows. Rather than struggling to write a few words, he's written whole sentences, which is socially appropriate. And this is the effect of sertraline. By reducing the anxiety and the overstimulation, he's able to function a lot better. Moving on to ADHD, attention deficit hyperactivity disorder, there are three descriptions which underpin this diagnosis. So inattention, hyperactivity, impulsivity. So the inattention is the difficulty staying on focus, staying on track. The hyperactivity is the motor side. So that's the movement. These are the kids that are constantly fidgeting or moving around the room, cannot stay still. And this goes on from the minute they wake until they get to sleep. And the impulsivity is jumping into things quickly without thought or too much thought or planning. The management of ADHD, again, rests on behavioural environmental strategies, very much on occupational therapy with looking at the sensory integration, and of course on medications, because again, this is a biological condition that is often, usually 80% of the time, amenable to medications. By using medications, it's a lot easier for the person to focus and learn the behavioural strategies that are needed to help them, especially with schoolwork, assignments, and working, but also driving and motor activities. So the medications that we use for ADHD are primarily stimulants. So it sounds counterintuitive using stimulants for someone that's hyperactive, but what the stimulant does is it stimulates the braking system. So it helps the person put a brake or put a hold on their hyperactivity and their brain overactivity. It helps them slow themselves down and take back control so they can get through a task a lot better than without the medication. These meds don't work for everybody. They do work for most people if they're appropriately and accurately diagnosed, and sometimes people respond differently to the short and long-acting versions of things like Ritalin, or sometimes they need a different chemical such as dexamphetamine. The psychiatrists now are using a lot of lisdexamphetamine, which is Vyvanse is the brand name. And again, that sometimes works better for some, and it's relatively new. We're still very happy in the Fragile X world with things like Ritalin, whether it be short or long acting. And as I was saying, sometimes it's just important to try people on a small dose for a short period of time, see how they're getting on, then move them to a long-acting and see how they go. Some people prefer the short-acting. The higher functioning kids and adults that can tell us will often be better at describing how they're going, but usually you can see fairly quickly whether somebody's functioning better or not on these medications. So not everybody needs them, but because ADHD is so common in Fragile X syndrome, it's good to think about it, assess, get some expert advice, and then do a trial of medications. This is especially important for learning. So if a kid can't sit still or can't focus on something for more than a couple of minutes, learning's going to be hard. If you can increase that length of time to 10, 15 minutes or longer, they're going to get a lot more out of their educational system. So aside from stimulants, if it doesn't work for people or people don't tolerate them, the other ones that are used very commonly are clonidine, which is brand name Catapress, and we use that a lot in very young kids. Intuniv is an equivalent type of thing, guanfacine, same sort of family, but it's long-acting. And there's some other options. Strattera was actually a combination of an SSRI and a stimulant, but it's been taken off the market. So the two major medications that are, or two most common medications that are used in ADHD is methylphenidate and dexamphetamine. These are stimulant medications. They're approved for use in kids over the age of 5 years old. They tend not to work under that age because the child's brain just hasn't developed sufficiently for that braking system to be there enough for these medications to work. Most people respond. They improve people's abilities to focus on a task. They also help with socialization. This is something that's really important with Fragile X syndrome, and Ritalin in particular is well known to help people focus on the social interactions, which is one of the deficits in Fragile X syndrome. The short acting is very short acting, it's 2 to 3 hours. So if it's taken at 9 o'clock, it'll get a kid through a school day only until 11:30. They need another one at lunchtime for the afternoon session. There are well-known side effects that occur in a percentage of kids, not in everyone. Effects on appetite, sleep, rebound. So when the medication runs out at that 2 hour mark, or with the long acting at the 6 to 8 hour mark, people can feel a little bit low. But this needs to be monitored by the prescribing doctor. And if these are a problem and the person doesn't get used to the medications, then the medication can be stopped. So it's often a balance of working out, is this medication helping with the schoolwork or not? Some people get onto the meds and they stay on them for years and years, and this is not reviewed. There's no harm in stopping these medications for a short time. And what a lot of families do in our experience is just use these meds for the school days, so Monday to Friday, and they don't need them on the weekends or holidays unless there's major hyperactivity. There used to be a big argument against these medications, people worried about them being traded in the schoolyard, and that certainly is one of the reasons why they're so tightly controlled. But in Fragile X, that's really not an issue. And in people without Fragile X who are using them, it's not an issue. In fact, the converse was shown that Royal Children's Hospital did a study over a long period of time and showed that kids with ADHD that were not treated for their ADHD had a higher incidence of being charged and going through the legal system for doing things that they shouldn't have been doing. There's an old friend of mine who was diagnosed at the ripe old age of 42 with ADHD. And as he said to me at school, he was always getting suspended and threatened with expulsion and getting the strap for being, as they used to do in those days, for being naughty. And in fact, it was his ADHD, and his life turned around after being prescribed Ritalin by his psychiatrist. Okay, this is a young fellow with ADHD. We're trying to get him to do anything he won't take instruction. He's just, he's not going to do anything. He can't focus, so he's getting agitated. So he's putting something in his mouth to try and settle himself down. So we thought we'd try him on some Ritalin. We gave him a half a tablet in the room. And here he is 20 minutes later, quietly tying up his shoelaces. So this is almost a bit of a party trick, and it's not always as obvious as this, but this is what we like to see, and that's the effect of the psychostimulant medications in terms of helping people focus. So here's the writing of a young child before and after Ritalin, methylphenidate. So you can see the word yes is there, and egg. You can almost not read that word egg. So yes, and egg. And look at the writing here and how firm and neat it is. And so this is one of the other big pluses with these medications is not only do they help with focus, they actually help with motor control. So you could argue you could give these to a lot of doctors to fix up their handwriting. How do we determine if someone has ADHD? Well, first of all, it's common in the general population. About 1 in 10 male students under the age of 16 has ADHD. That's without Fragile X. It's about 80% of kids with Fragile X, and obviously a lot of adults as well. So we follow DSM-5 criteria, and there's a whole process that needs to be gone through. And these are the sorts of rating scales questions that we ask. So again, the conditions persist for more than 6 months. They interfere and interrupt with a person's home or school setting. They can vary, so they don't all have to be there, but there's often other conditions as well. And we use these questionnaires, so you can read through these and you'll see fails to give close attention, difficulty sustaining attention, doesn't seem to listen, like that video we just saw, doesn't follow through on instructions, doesn't get the job done. And I'm sure you're all sitting there thinking, well, I know people like that as well. And so there are a lot of people with sub-threshold ADHD, so they don't meet the criteria by having 6 of all of these. They might have 3 of them. And they don't necessarily need medications, but it's good to be aware so that they can then put in environmental modifications and other strategies into their life to get their tasks at work or at home done. And these are the motor symptoms, so fidgeting, running, climbing, not able to sit still, talking, and then the impulsivity, blurting out things. And you'll recognise these traits now in probably a lot of people that you know. And you know, if it's a problem that's interfering with their lives, socially or at work or at home, then they may benefit by being assessed in a trial of medication. And we send these scales to people. We ask them to fill them out, either themselves or their parent or their teacher or someone who knows them well. And it's not a black and white thing. It's getting an idea of where they are, and it has to be considered in context. So, you know, somebody's just moved countries, moved house, moved home, had some major upheaval in their life, then some of these symptoms may be there, which will go away once life settles down. We're talking about people who've had these long term. So just to go through, I've spoken about 2 disorders, so anxiety and ADHD, just to go through some of the other conditions that we see in Fragile X that we deal with and that we use medications for. These are the different classes of meds that I put up early. So you'll recognise some of these names. And the antidepressant anxiety medications, the SSRIs or the SNRIs, so they're the serotonin or noradrenaline reuptake inhibitors. They help people function, and as said, usually at low doses. We've spoken about the stimulants, and they work through the dopaminergic and noradrenaline systems. So a third class of medications are mood stabilizers. These are medications that are used for epilepsy, because epilepsy is a condition where the electrical impulses in the brain fire off abnormally, and these medications slow that firing off that's not wanted. And we presume in Fragile X syndrome, where the structure of the brain is different, we know that the electrical impulses fire differently, not necessarily enough to create a seizure. So a seizure occurs when the electrical impulses hit the motor part of the brain, and so people might fling their arms or legs around, but they can sometimes also hit the emotional areas and create behavioural change. So we use these medications, for mood stabilizers to help people settle. The atypical antipsychotic medications are named atypical because they don't make people drowsy as the older ones from decades ago used to do. Psychosis is where people are out of touch with reality, and this is not the case with Fragile X syndrome for the most part, but the medications can be very helpful because they work to decrease the anxiety and agitation and sometimes aggression that can occur that we see as a result of the overstimulation and the hyperarousal in Fragile X syndrome. So one of the more well-known ones is Zyprexa, which is the chemical name is olanzapine, Abilify, aripiprazole, and quetiapine, which is Seroquel. Now, in Australia, these medications are available on the pharmaceutical benefits scheme. So they would be used for designated conditions such as schizophrenia or bipolar disorder. However, in the USA and overseas, they're used often first line for anxiety. So they're great for anxiety without affecting people's cognition, their ability to think or learn. And they're very useful for that. They're also great mood stabilizers as well. So they're a good option to consider, especially if the SSRIs or SNRIs have not worked. We use medications for bedwetting, melatonin, clonidine for sleep. There's some of the older medications, the old tricyclic antidepressants we sometimes use, such as imipramine. And there's a whole lot of others that are used less commonly. But they all work for conditions that we see in Fragile X syndrome, the same as they work for anybody else. So there's some newer medications that have come out, some of the newer atypical antipsychotics, asenapine, lurasidone. Again, these can be a little bit expensive off-label, but if they work and if you've got private extras health insurance with extras cover, you can get a little bit back from there. Metformin is a medication that's used in diabetes, but there's also been some work with a lot of other conditions, and we have a few families that are using it with their kids and have found that it's improved both their ability to socialise and social settings, they function better, and their speech and language, which we also see with sertraline. Minocycline has been shown in some studies to improve people's cognition. The only problem with this class of medications, the tetracyclines, is that it can result in stained teeth and lines on the bone. So it's quite off-label. It's not something that's used in many young kids in Australia at the moment. The statins are a group of medication used for lowering cholesterol, and the lovastatin, which is actually not available in Australia, has been shown to improve cognition, both in older people and in younger people. So there's work going on in these areas to delineate where and when they can be used. There have been a couple of studies of the mGluR5 inhibitors done by Novartis in the past, and there's the current Zynerba study of the cannabidiol gel trial which is gel rubbed into the skin, and that study will finish towards the end of the year. So to finish off, the underline with medications is that they can be terrific. They will help a lot of people, and they're best when they're used with behavioural management strategies. They're synergistic. So to reiterate, I'd like to thank the Associations of Fragile X New Zealand and Fragile X Association of Australia for putting this on. This is an educational tool, and the medications used need to be all used under the supervision of a qualified medical practitioner. Thank you.